Dear colleagues, welcome to this OncoAlert VJ Oncology Roundtable. We will be discussing some of the most exciting research that is being presented at the Oncology Nursing Society's Bridge meeting, which takes place on September 8th, 10th, 15th, and 17th. And of course, the European Oncology Nursing Society meeting in September 19th to the 21st, happening at the same time as the European Society for Medical Oncology meeting. Before I begin, I would like to introduce today's discussants, some amazing oncology nurses and researchers from the US and Europe: Darcy Burbage, Helena Ullgren, Christine Ladd, Merel Van Klinken, who cannot be with us today due to family emergency, but her slides will be presented. I'm your moderator, Gilbert Morgan. I'm a physician working in medical oncology and also the director of the OncoAlert network. Today's roundtable will be as follows. Each discussant will pick a subject and will give a short 4-minute presentation on the research that will be presented on that specific topic during ONS or the EONS meeting. The discussant panel will then give their opinion and insights on that specific topic. The topics are as follows: innovative approaches to improve patient care, presenter Darcy Burbage; precision medicine, Christine Ladd; COVID-19 and cancer, Helena Ullgren; supporting informal carers, Helena Ullgren. At the end of the presentations, I will give a short presentation on how this research is important to the oncologist and all doctors involved in cancer care. So without any further delays, let's begin. Darcy?
Thank you, Gil and VJ Oncology, for inviting me to present today alongside a few of my very favorite colleagues. As Gil mentioned, the ONS Bridge is the inaugural virtual conference for oncology nurses held over 4 days, where nurses can learn about the latest in cancer care. Sessions encompass clinical practice, leadership, management and education, and include topics such as navigating financial toxicity, the importance of self-care for oncology nurses, diagnostic oncology, plus a glimpse of the future of cancer care, and of course, COVID-19 and cancer, plus many others. Based on all of that information I just shared with you, I had a hard time selecting a topic as there were so many great sessions to choose from, but I kept coming back to this theme of nurse-led innovations to improve patient care. In both of these programs, advanced practice registered nurses led the program's development, which included an interdisciplinary team. As we know, cancer treatments can have cardiac toxicities, and those patients with pre-existing conditions or new cardiac comorbidities are at increased risk. In the cardio-oncology clinic, nurses perform initial consults and manage follow-up care in collaboration with the patient's treating oncology team, provide education on lifestyle and medications, as well as triage urgent issues. Preliminary data has shown improved patient outcomes as well as increased patient and clinician satisfaction. Because oncology care has shifted to a mostly ambulatory setting, there's been an increased need and volume of same-day visits for treatment-related effects, which has led to a high utilization of the emergency department, potentially exposing our immunocompromised patients to infectious diseases in the waiting room. Once again, advanced practice nurses led a task force to evaluate practice and establish guidelines for a visit in the oncology-specific urgent care center. Preliminary data have shown that urgent care appointments have reduced emergency department visits and subsequent hospital admissions and led to increased patient and clinician satisfaction. Having both of these programs available in community cancer centers improved access to high-quality care, improved collaboration and communication with oncologists, and were found to be cost-effective. Another innovative approach to influence patient care are the oncology nurses' role in research and evidence-based practice. Nurses are leading the development of evidence-based practice resources to assist in the management of side effects related to cancer treatment and care. ONS is moving to transition some of our putting evidence into practice resources, also called PEP resources, to full clinical practice guidelines. Developed using rigorous methodology, the guideline recommendations can be utilized by nurses and other oncology healthcare professionals to improve care for patients with cancer. Guidelines developed thus far include cancer treatment-related skin toxicity, hot flashes, and lymphedema. Those currently in progress are constipation and radiodermatitis. And finally, priorities for the ONS research agenda have been identified. The ONS research agenda serves to identify gaps in the knowledge base needed to deliver quality cancer nursing care to patients and families. 3 overarching priorities were also identified where new scientific knowledge is urgently needed, and there were several cross-cutting themes that help provide context for these priorities, which included the aging population, survivorship, as well as healthcare delivery. Examples of areas for further research include the development, testing, and validation of patient-reported outcome tools in patients receiving immunotherapy, examining the role of technology, including telehealth strategies to improve access to care, along with developing and testing interventions for culturally sensitive, palliative, and psychosocial oncology care. So stay tuned next week to learn more.
Any thoughts on Darcy's presentation?
My thought was, thank you, by the way, Darcy, excellent summary. And I really feel I want to hear about this. And also, one of the thoughts that I kept on thinking was that this really shows the need for advanced practice as well, and how much as cancer nurses we can do. So it gives me even more, energy to think about how we need to develop more advanced practice also throughout Europe. And I think in the US, in a way, you're a role model with the way you have developed advanced practice, because many of those things that you were raising is it requires you have advanced nursing practice to do those innovations. So yeah, thank you for that. It's really good.
I agree with you, Helena and Darcy. I absolutely love the idea of oncology-focused urgent care centers. It really allows oncology nurses to act at that peak of their licensure and their expertise, and identify these critical situations and values, and implement evidence-based solutions for the patient quickly. And it's a fantastic way to keep our very fragile patients out of the hospital emergency departments and out of from having unnecessary hospitalizations, especially now when we have this pandemic going on. So very exciting information and innovations.
Thank you very much, Christine. Okay, well, moving on to our next presentation on precision medicine. Christine Ladd.
Okay, well, thank you for having me this morning. I'm going to talk a little bit about precision medicine, which to me is a little bit of an oxymoron. It seems like we talk about precision and we're narrowing down to focused treatments for patients, but it really is such a huge topic. So I struggled a little bit to narrow it down. So this is a very high level presentation for you. But when we talk about precision medicine, what are we really talking about? Talking about using very specific information about a person's cancer to help diagnose, to treat, to prognosticate, and provide appropriate surveillance throughout their cancer trajectory. It is rapidly revolutionizing cancer care. And it's about developing and delivering the right therapy and the right approach for the right patient at the right time, whether that's diagnostic or therapeutic. Seems right now the greatest abundance of research and the most enthusiasm obviously is within cancer treatment. And there is a great potential that exists with precision medicine to cure more types of cancer, increase survival, and improve overall patient care. So why is precision medicine so important to oncology nursing today? And what you need to understand, obviously, is that precision medicine touches every single aspect of oncology nursing care, from prevention methods to early detection, all the way, obviously, through diagnostic and treatment modalities, and even supportive care. And while we tend to get really excited about new treatments and their potential to create longer progression-free survival, overall survival for our patients, there's just so much more to it. So we really have to dig deep and understand the role that nurses play in positive patient outcomes. In the U.S., nurses have claimed the #1 rank as the most trusted professionals in our country for 18 years in a row. So as nurses, we often get the privilege of spending more time in front of the patients than the oncologist does. It just fosters and creates this intimate relationship. It's just different from any other patient healthcare provider relationship or nursing specialty. The patients tell us about their hopes. They tell us about their dreams. They also ask questions that they may not have asked their oncologist because they felt uncomfortable. They tell us about side effects they're experiencing. And it's really because of this relationship that we are able to foster. Because of this relationship, this close patient oncology nursing relationship, it impacts oncology nurses and what we can do and how we can impact across the board as far as precision medicine. Oncology nurses, as a result, have a responsibility to learn about the science and initiatives supporting precision oncology. We are at the forefront of the cancer epidemic, battling it every minute of every day, all the way around the world, delivering care, carrying out the clinical trials, and advancing evidence-based practice. This allows cancer nurses to provide clear patient education to increase their understanding. It allows us to address challenges that the patients face. And this is actually what leads to better outcomes and quality of life for our oncology patients. The challenge with precision medicine, as far as education, is that it's a tremendous challenge in keeping up with this rapidly evolving concepts and findings. What we're seeing is that although precision medicine and genomics are moving forward very quickly, it's extremely difficult to keep up with genomic literacy and precision medicine literacy, keep pace. So there's this huge, pressing, growing need for education in oncology nurses in terms of understanding and appreciating fundamental treatment modalities like CAR T therapy and immunotherapies and the very specific side effects and known adverse effects that these therapies can elicit. The need for oncology education is really twofold, so that the nurse can provide the patient education and therefore manage the side effects and promote regimen adherence and keep the patients out of acute care facilities, but also so that the nurse can quickly navigate and treat known adverse events like cytokine release syndrome and immune effector cell-associated neurotoxicities when they happen. Another challenge that precision medicine has brought about has to do with ethics. On top of the challenge of keeping up to date on new treatment modalities, precision medicine is creating new and evolving oncology nursing roles in the realm of ethics regarding privacy, confidentiality, fairness, and cost. And oncology nurses are uniquely qualified to provide insight into these issues faced by our patients. As I mentioned before, precision medicine presents both tremendous potential and tremendous challenges, and that's where our oncology nursing bridge comes in. So this is just a quick screenshot with some of the topics that are going to be coming up for our ONS bridge. I am just so excited about this new launch of new offering for Oncology Nursing Society. It's going to help connect oncology nurses with resources and education that will support us as we navigate the challenges and issues presented with rapid progression of precision medicine. So like I said, these are just a few examples of content that are planned specifically pertaining to precision medicine, both in clinical practice, in terms of professional practice areas and ethics and advocacy. So as you can see, there are so many opportunities for oncology nurses to learn and earn contact hours of nursing continuing professional education development specific to precision medicine. There'll be live sessions where the nurses can interact with expert speakers and engage with other nurses within our profession. But what I think is exceptionally interesting, cool, however you want to phrase it, are that there are over 500 e-posters. And these are, is research by nurses, oncology nurses, and what they've learned, what they've done, and the impact that they're having and how we can learn from them and do the same around the globe. So I have opportunity to review over 500 of those as well. And attendees will have the opportunity to learn how they can leverage their leadership capabilities as well. And that is all I have. If anybody would want to reach out, there's my contact information, but hopefully we will get to see you on September 8th, 10th, 15th, or 17th. And then it will be available on demand as well after that through the 17th of October. So thank you.
Thank you so very much. Darcy, any thoughts?
Yeah, first, thank you, Christine. That was a really great overview of precision medicine. And I was thinking when you were, discussing about the importance of managing adverse effects from immunotherapy. As you touched upon, it really calls upon for precision education of the patient, as most immune-related adverse effects are different than the usual side effects that patients may have experienced if they were on traditional chemotherapy prior to starting immunotherapy. So as oncology nurses, it's important for us to perform a thorough baseline symptom assessment before patients start their immunotherapy treatment or CAR T-cell therapy, which can also help facilitate discussions of these immune related adverse effects and side effects that they need to watch out for, and also the importance of providing them with a card that they can carry with them that I know ONS has developed in some other organizations. So in case they are somewhere else, that the clinician can know how to treat them and contact their medical oncologist to help manage these effects. So thank you. It was great.
I think you really highlighted, Christine, thank you, the challenges. And as a cancer nurse in the era of precision medicine or personalized medicine, I see the challenge that we are used to, but even more coming on stronger, personalized care. Like how do we really get our patients to, for example, follow the self-care advice we give them? It requires that you know them well, you see them a lot, you follow them throughout, and I think the symptom management in precision medicine has been taking us to a higher level of that, because you can keep them on treatment longer if they contact us earlier, which is sometimes not what patients do. They're scared to sort of reveal too many side effects and things like that. So I think you highlighted really well all the challenges, and we have so much to learn, and I look forward to hear more. Thank you.
Absolutely. And now moving on to the next presenter, Helena Ullgren, who has the tough job of having her own presentation on COVID-19 and cancer. And then she will be taking on Merel's presentation on supporting informal carers. So after she will do the COVID-19 and cancer presentation, we will take on thoughts, and then we'll start off with supporting informal carers.
Okay, thank you so much for inviting me, Jill. And I'm excited to also hear that we are sort of sharing experiences and hot topics between US and Europe. And I think we have a lot of challenges that we really have in common now. So I want to talk about briefly one of the hot topics that we will also address in EONS 13 session in September. So how do COVID-19 affect our patients? And of course, this is just a few of the challenges I've been highlighting. Of course, we don't have enough knowledge, we don't have enough evidence. This came just down on us, basically. And what we have seen so far, I think, throughout not only Europe and Sweden, where I'm from, throughout the world, is delays in diagnosis and treatment. And not only because we need the resources elsewhere, because the patients are scared to come into treatment and to come to the hospital. We're seeing unusual complications from treatments, and we also see how isolated our patients are. They come when they have to the hospital, and then they isolate at home, scared to get COVID-19, and really this put a lot of strain and stress on our patients in addition. And also symptom assessment that are even more challenging, I'd say, with this pandemic ongoing. So how can we learn? Of course, we need a lot of research, but we also need to have things like this and share, experiences between each other. And I think one of the biggest challenges I'm facing is, for example, how we, what type of treatment is more risky if the patient's getting a COVID-19 infection. Is it immunotherapy? Is it chemotherapy? And the timing? And we do know too little about that, and we can only sort of now see some evidence coming on to pointing towards that it's not perhaps going better for patients on immunotherapy that perhaps people thought from the beginning the outcomes are even worse there. But we need so much more information on this. And how do we treat our patients safely, but perhaps need a treatment urgently, but they are testing positive for COVID-19? And how do we assess and differentiate between difficult symptoms? For example, we have seen a few pneumonitis that we thought were COVID-19, but they were actually pneumonitis from radiotherapy to the lungs, things like that. And also how we keep the patients safe and manage to include family caregivers despite that they can't come to the hospital, for example. I have also seen a lot of need to be better in infection control and to educate our other healthcare professionals. I think the nurses and assistant nurses are experts on hygiene and infection control, but we need more education to everyone, really. And also, as I think Darcy mentioned, telehealth is coming on strong, which is something we could use more. So in one way, I can see that the cancer nurses are coming in so clearly here. The need for holistic symptom assessment and support is so strong, even more now during COVID-19 pandemic, I think. So I really hope you can join. The session is, it's 4 speakers that will talk about both early research and quality assurance projects. And then we will have a live discussion. So I really hope you can tune in. And yeah, I look forward to perhaps see more of you there. Thank you.
Yeah, what I think is really has been challenging is the isolation that the oncology patients and their supportive members are facing, as well as the oncology nurses. But when you already have a difficult situation that's stressful, it's anxiety-ridden, patients aren't in a place to absorb information and education that's provided to them. So I think this has really brought to light how important it is to provide patients with clear and concise printed information that they can take home for reference later, to look back at when they need it, but also to be able to give that to their caregiver so that the caregivers feel supported. It gives the caregiver a concrete material to review at home and just creates an extra layer of support. And the mental health needs need to be a continued point of focus of research, particularly in this instance, and how heightened stress and anxiety from the pandemic may even be contributing to decreased adherence to treatment regimens, especially if they're oral, and lesser quality outcomes. I think it's going to be interesting to see in the long run.
Thanks, Helena. That was, a great presentation. And I kept on thinking when you were talking about, when cancer and COVID collide. And, we've really had this experience with the pandemic. And I think we're just really beginning to understand how COVID-19 affected our patients and their family members, and, as well as us as oncology nurses and other clinicians. So, we were all trying to figure out how to keep them safe. And then hearing from patients and their family members how scared they were being dropped off at the cancer center for their treatment or surgery and being by themselves, and perhaps if they were there for a 6-hour infusion. And we, as the oncology nurses, were providing them support the best we could, trying to maintain social distancing all at the same time. And, in addition to that, the end of life care for patients when, perhaps they were once again alone, or if only one family member were able to be present. So I think we really need to pay attention. And as both you and Christine touched upon, these mental health issues need to be addressed now and ongoing as the pandemic continues. So thank you for bringing that up.
Excellent. Now we can move on to the second presentation, and that's on informal carers.
I want to say this presentation was made by my colleague from the Netherlands, Merel Van Klinken. She couldn't be here today, but the topic that she picked from the program was supporting informal carers. That will also be on the 20th of September. So, and I think everything we talked about, we touched upon this topic, I guess. And one of the things that Darcy was mentioning now, that's even more sort of in the spotlight now is where the patients die. And dying at home, we know from previous research that many patients really prefer to die at home. And that's one of the situations where the family caregivers or informal carers, whatever you choose to call them, is something that we require a lot from them, and they need a lot from us. But I think that's where we fail sometimes. And many patients that doesn't have that type of support at home, and if we fail to support the family caregivers, they spend their last days in hospital instead. And so I think a really key factor as an oncology nurse or all healthcare professionals in cancer care is to see the family caregivers and to really reach out to them and try to support them the best we can. And we have many issues that we need to address because from previous research, we have seen that family caregivers actually do work similar to healthcare professionals at home, but without education. And they coordinate care, they titrate medicines for the patients, they decide when to call us and things like that. So we need to work more systematic on health literacy and to help them to care for each other, for themselves. And also perhaps more evidence on how to support them. What is the evidence? What is the interventions that we need to do to support the family caregivers? So I hope you can listen in on the program, and I think they will speak about the role of the nurse in terms of supporting the family caregivers and to educate them. And perhaps I'm hoping to hear something on what type of interventions are suggested to really support them in the right way. So it's the 20th of September, and I hope you can join. It will also be a discussion on this. Thank you.
Thank you, Helena, and also Merel for putting these thoughts together and sharing them with us. And absolutely, I am in awe of our family caregivers. I mean, what they do is just amazing, and most of them have no healthcare background at all, as we know. And I think it's really important, and you had touched upon that, and how that we recognize the valuable role that cancer caregivers have and how valuable it is to the person living with cancer. And as oncology nurses, and Christine touched upon this on her presentation too, is that we spend a lot of time with the patients and their caregivers. So we're the first ones to see their distress and their stress. So, we can really pick up on that, and help them manage the care that they're providing to the patients. And also it's important that we remind them that they need to take care of themselves as well. And it's okay to ask for help. It's okay to accept help. And it's perfectly acceptable, to take time for themselves, as they very much should, if it's, eating healthy, exercising. So it's very important. We can also help facilitate, interventions to help improve the health-related quality of life that they're experiencing. So I think it's great that you touched upon, what are those interventions? And I've heard caregivers say, it's hard to be on the sidelines. So I think, as you mentioned, that we're really beginning to look at research and help define those interventions to help improve the quality of life of our caregivers, because they provide such a great source of support and care for their loved ones. So thanks.
I completely agree with you, Darcy and Helena and Merel. What's really complicating for this right now is the very important aspects of psychosocial support are the measures that so many of our facilities are having to put in place right now to protect our fragile population during the pandemic. So here for us in Virginia, oncology practices and hospitals aren't allowing visitors to come into the facility at all, out of just protection for the patients, protection for the healthcare workers, and then the visitors as well. So this is creating a huge challenge for the oncology nurses, but those caregivers that aren't able to be there at the bedside when something critical is happening. So, oncology nursing education is having to take an extra step to try to push our nurses to be innovators and work hard to find new ways to leverage our technology. For example, with FaceTime, Zoom meetings, to ensure that the patients and the caregivers are well supported. So whether that means, the oncology patient that's on their day one of treatment and doesn't have somebody there with them to learn, but the nurse pulls up her iPhone and calls and has a three-way conversation with everybody so everyone feels supported and gets the information, or if it's on Zoom, they're doing it in a way that's safe and at a safe distance. So I think it's not only important to really have those caregivers involved, but it's just a really big challenge right now that the nurses, oncology nurses, have really risen to the occasion and just found ways to get it done.
Thank you so much, Christine. Thank you much, everyone, for great presentations. I have to say it's been quite hard to kind of hold my tongue. I have thoughts on everything. These are all, the meetings are going to be great with the subjects you guys have touched on. However, there are specific things that I would like to touch on. Of course, coming from the oncology side, one normally has a tendency to go into the treatments and the fancy drugs and everything that ends in ab. But I'm going to try not to go there today because there's so much more than that. And there's so much that an oncologist could actually learn. Not just because it's an Oncology Nursing Society meeting does not mean the oncology physician cannot learn from it. And I think that is the one thing that I'm trying to get our colleagues to realize is that we are a team and we can learn a lot from each other. So I'm going to do my presentation, which is it's what I think an oncologist should be learning from the presentations that y'all just gave. Thank you all so much for wonderful presentations. And this is my take on what the oncologists can learn. And of course, the breakdown, which we have already had, are innovative approaches to improve patient care, precision oncology, COVID-19 and cancer, and supporting informal carers. Now, when talking about innovative approaches to improve patient care, these are all great approaches. It was a wonderful presentation, and we need to adopt these to care better for our patients. However, the topics that I'm very glad were addressed were the topics on palliative care, psychosocial care, and health disparities. This is something that everyone in oncology should be championing, from oncologists to oncology nurses to patient advocates. We have had many studies that have indicated that early introduction of palliation or a palliative team can lead to better quality of life. And I'm very glad that we are trying to remove that stigma and that we're coming along with palliation. So there's a lot of really good research that can be done and that it's coming out within this area. In terms of health disparities, this is something that is hitting close to home, as minority populations have a higher total incidence of cancer and a higher total death rate. I see this, I saw that in my home state of Texas. I now live in Sweden. I've done so for 10 years. However, I've done some research there, and especially around South Texas, where I'm from, that it's predominantly Hispanic, there is a lot of these disparities. So I think a lot needs to be done here in terms of screening and, of course, the inclusion of more minorities in clinical trials. And we're very happy that this is something that is gaining traction due to a lot of support from NCI, from other societies that have really taken this on. So I'm very excited to have this kind of research being presented at these meetings. Talking about precision oncology, I know everybody's thinking I'm going to hop onto how wonderful these drugs are, and they are pretty awesome. I am working in oncology. You do have to be a little bit of a nerd, and I am. So we're living in a very fantastic time where certain targets that were before we thought were undruggable, now we actually have FDA-approved medications that it's a big deal, because not so long ago we thought that this is something that it was a dead end, and now we're seeing that with the technology, it's making it possible to start treat these alterations, and not just based on the cancer type, but based on their genome. So, however, the other side of the coin is the financial toxicity that comes with these kind of treatments. So although novel doesn't necessarily mean expensive, it almost always does. We need to be advocates for our patients and remember that money to pay for medication has to come from somewhere. Some patients have to travel very long distances, pay hotels, parking, childcare, you name it. So although we as doctors are very much cheerleaders for these therapies, we also have to take a step back and act as facilitators in helping patients address these kind of problems. So I'm very happy that all this research in precision medicine is happening, and I really like that I saw in there about financial toxicity, because I think this is something that we all need to start addressing because it's really affecting our patients. In the area of COVID-19 and cancer, it's been amazing how we have been able to adapt under a very short time. Countries have learned from each other's experiences, and many things have been implemented. Some things are very much here to stay, such as the case with telehealth. However, one of the things research has taught us, or what we have seen, is that we can expect a large boom in cancer and avoidable cancer deaths as a result of this pandemic because of the delays in screening. So this is something that we're going to have to prepare ourselves, and we're going to have different plans. So this is good that we're already thinking ahead and figuring out how we're going to take care of our cancer patients in the future. Not only that, if we are in the middle, I guess one could argue if we're in the middle of a second wave or if it's been just one big wave, but we can adapt so that we can decrease this. Or if this happens again, after we get over this, so that we don't fall into the same traps and our cancer patients that are vulnerable do not fall victims to this. So now, in supporting informal cares, I went a little bit off of a tangent here, but this is the reason why. So for me, it's amazing what an oncology nurse can actually do in the life of a patient, even especially in the life of a doctor. Here in Sweden, the role of the oncology contact nurse is essential. An oncology professional who has constant contact with the patient, who knows that person's situation in real time. And this allows us to work in a team. There are a lot of things that a contact nurse can solve. However, in cases where it requires for an oncologist to be involved, there are always available times there because the contact nurse has taken a lot of the work. So as an oncologist, you can hop in. You're not, because it's been kind of triaged, the things that you're going to take on. Now, the reason I say this is because just the same kind of importance that we put on the contact nurses, that information that contact nurse can give to the informal carers is just gold, because they are the ones that are in constant communication with those informal carers. They're the ones that know exactly what they can recommend that those carers do, and that gives our patients a big sense of security. So I think this is something that definitely we need to focus a little more on this, because we are going to rely on informal carers more and more as this pandemic continues, and of course later on if it happens again. So my take-home messages, we need to include more minorities in clinical trials and introduce earlier palliative care, which I think some of the research that is going to come out is going to tackle. Although new innovative treatments are great, we cannot forget the financial toxicity they generate for our patients. We need to be able to deal with the increase of cancer cases that come as a result of delayed screening and treatments. And the role of the oncology nurse is very important to improve the well-functioning of an oncology team, but also what that nurse can give to the informal care. And with that, I thank you very much.
I will just say that it seems appropriate to me that 2020 has been deemed the year of the nurse, and we got a pandemic as our gift. But what I would say is oncology nurses, and within ourselves, we recognize ourselves as nurse scientists, researchers, and innovators. But outside, I don't know that everybody always sees that as well. So I really thank you for this opportunity to really just show how nurses are part of that team and how they make such a big difference as far as research and innovations, because they really are superstars. The challenges that were brought on by COVID-19 really just magnified the extraordinary talent, the skill, the innovativeness of our oncology nurses across the globe. I've seen firsthand, time and again, oncology nurses rise to the challenge. So I invite you again to come and learn more with us at the Oncology Nursing Society's Bridge program in September 8th, 10th, 15th, and 17th. But thank you for having us.
Thank you, Christine. Helena, any parting thoughts?
Yeah, I mean, first I want to thank you all, and it was very inspiring to hear, in a way, refreshing. You're not alone in many of your challenges, and you can, help each other. And I think one good thing that came out from this pandemic is things like this. We've been much better with actually doing webinars and meetings, like this. So I think that's very good. And then in terms of what you said, Jill, of course, I agree with all your points. And I think what we've shown also a little bit today here is we should have more sessions in the future together, I think, and address topics from more multidisciplinary. I mean, we have the EONS ESMO conference at the same time, in the same venue if we meet. And now when we have virtual, we have them during the same dates, but we should have also sessions together and address issues like, for example, precision medicine or family caregivers together. And same for you guys in US. I mean, ASCO, ONS, we should have address issues together much more than we do. And I think that's one of the things that really is, struck me when I heard Gil's sort of wrap up and comments from the oncologist perspective. Thank you.
Thank you, Helena. From the oncology side, if I might add, I was in an EONS ESMO session last year. I gave it I believe it was the second or third day of the Congress. And it was a wonderful experience to be able to share the stage with some of our oncology nursing colleagues because you're able to give the whole spectrum. It's a 360 view. Now, the wonderful thing about oncology is that there is no hierarchy. We all do a job. We do it for our patient. And we have very different jobs. So all we're doing is just giving our different bits of our jobs of how it comes together into a whole to actually help the patient in the best way. So it's something that I can only advocate for, that tighter contact and tighter, not only communication, but also working together between the oncology nursing and the oncologist. Because I think a lot of good can come to that. So I really like that part of EONS and the ESMO Congress, is that it's bringing us together. And I've even seen a lot more oncologists showing up to the tracks that are branded as oncology nursing sessions, but there's still a lot that we can learn. So I urge all my colleagues out there to just break the mold a little bit and step into a session that is not labeled immunotherapy for oncologists. Darcy?
Great point. And may I just add, Gil, that, with this, pandemic came opportunities. And I've seen more collaboration between, oncology nurses, oncologists, as well as patients, because we've all had to work together and we're all in this together and we're getting through this together. So this really has, although it's kind of usurped all of us across the globe, it really has brought us together to improve patient care and be part of that, really see each other as team members. And I think, this is only the beginning of, perhaps a pandemic positive, if there could be such a thing, and collaboration more with quality improvement, research between the disciplines, and also bringing in our patients who are living with cancer. And and finally, I think the importance of, and what I love about ESMO and EONS is that you guys are together.
Perfect. With that being said, we thank you all for joining us today. Thanking our colleagues, Darcy, Helena, Christine, and thanking Merel very much for her contributions to the program and sending her our well wishes. Hope everyone is tuning in for the ONS Bridge and the EONS meeting. Remember that we're all part of the same team. And just because something is labeled as oncology nursing track does not mean that the cancer physician cannot learn something from that. So encouraging all our oncology MDs to tune in and watch this great science that is coming out of the two meetings. Of course, a big shout out to all of our oncology nursing colleagues, and hope y'all enjoy this wonderful meetings. Thank y'all.